Thank you so much for allowing me to a live broadcast. This is my first presentation as a live broadcasting related to an important topic in clinical medicine, which is the challenges which are met with in modern clinical practice. I found this topic is very important since many of the physicians and surgeons or the healthcare professionals are not focusing on this issue or are not aware of this issue while they are practicing the. And since being a medical expert and a senior clinician and senior consultant physician, I found myself obliged to suggest this topic for live broadcasting by me, and I chose it as my first live video. So let me talk about, in short, about the what are these challenges which are met with in clinical practice, and what are the causes of these challenges, or what are the roots of these challenges in modern clinical practice. And in spite of the, let me first start with an introduction that in spite of the advances in the medical profession, in the practice of medicine, due to advances in two main issues or three main issues in the current clinical medicine. Number one, the issue of precision medicine, or personalized therapy, or individualized therapy, or individualized approach to treatment and clinical management. Number one, what's called precision medicine. Number two, the high technology in diagnosis and high technology in therapeutic options, that is mainly drugs, and also in the non-drug therapeutic options related to biomedics. But for me, the main issue is the high technology in therapeutic drugs, that is pharmacology used to treat disease, especially the emergence of the new drug groups for treatment of diseases, different diseases in different disciplines of medicine, internal medicine. Like the emergence of the biologics, which is a breakthrough in medical treatment, biologic therapy in different chronic diseases and even in some acute medical conditions, biologics. And also, which of course is related to better understanding of the molecular biology of disease, or what we call the pathobiology of disease. In spite of these advances in high technology and its role in therapeutic or pharmacologic industry of pharmaceuticals, with its many groups in different diseases, in autoimmune diseases, in cancer, in chronic medical diseases like in diabetes, like in bronchial asthma, like in hypertension, like in epilepsy, multiple sclerosis, headache, migraine. In all of these just examples, all of this we have new therapeutic options. Among them is what we call biologic therapy. And also the advances in, or the high technology in the different diagnostic tools in radiologic assessment, in radiologic investigations, in interventional radiology, regarding the different new techniques in CT scan and in MRI and in emission tomography and in nuclear medicine, and all these diagnostic radiology also tools which are helpful in diagnosis, as well as in the laboratory or laboratory diagnosis or laboratory diagnostic tools, in the serology, in the immune markers, in the immunohistochemistry and chemistry and the use of biologic markers, etc., which are helpful or which aid in diagnosis. So all of these diagnostic tools used in the laboratory or used by the radiologist to better delineate the disease and help in diagnosis. And these are very important diagnostic tools in current clinical practice, which allow the physician to be more able to reach to accurate diagnosis and do that in a short time and in an easy way in many cases and in many diseases. Despite of all of these advances in high technology in diagnosis and high technology in manufacture of drugs and the use of biomedics, and of course also the emergence of artificial intelligence in the healthcare profession and the precision medicine and its role in current clinical practice. Despite of all of this, there is still poor outcome of our patients. And still there are difficulties in diagnosis and mistakes in diagnosis and mistakes in treatment of our patients. And these are the main clinical challenges about which I'm talking. How can we solve these problems in diagnosis and consequently in treatment? Because if there is no proper diagnosis, there is no good treatment, or there is no correct treatment given to our patients. Diagnosis is the most important initial step in clinical management of the patient to reach to a diagnosis. Final diagnosis or definite diagnosis, not just a differential diagnosis, to reach to a definite diagnosis in that individual case, in every individual case, and try to tailor or give the best treatment or the best therapeutic options which can help this patient. Why there are still mistakes and there are still problems, or what we call challenges in diagnosis and or treatment? Because of many things. Because of the pressure, maybe, the put on the physician, because of the lack of what we call the problems related to clinical inertia, physician inertia, patient inertia, etc. Because of problems related to the factors affecting the clinical skills, which I talked about them in the last year in many of my presentations, in the clinical thinking, in the clinical observation, in the clinical listening, etc., during the history-taking process, and then during physical examination, which are the most important two steps. First, history-taking, and then physical or bedside examination, in order to reach a primary clinical diagnosis, bedside diagnosis, and then ask for investigations or tailor investigations for every individual case, depending on his problem or her problem, in order to reach to the diagnosis and then to decide about the treatment or take clinical decision about the treatment of the patient after reaching to the proper diagnosis or the definite diagnosis of the case. Still, we are meeting problems. There is clinical atmosphere is not good. The environment and the conditions under which the doctors or the physicians or the surgeons are working are not healthy by themselves. General atmosphere, the general environment, the stress, and this is very important, the stress. Doctors are in a hurry to reach diagnosis because they are pressed by too much or too many cases waiting for the doctor to see, whether in the outpatient department or the clinics or in the emergency rooms sometimes. That is both affecting both the acute medicine and in chronic medicine or chronic medical practice. In both conditions, the physicians are under stress for many reasons. And this, the physician or the surgeon being a human is affected or are affected, they are affected by pressures, they are affected by the conditions of the working environment and the atmosphere of the working environment whether in primary care or secondary care or tertiary care, whether in hospital or in a polyclinic or in a medical center, although the conditions in these different medical facilities or healthcare facilities, they are different, whether hospital or a clinic or in medical center. But the physician under any condition should carry on the clinical process regarding the clinical management of the patient smoothly and easily, and being calm and focusing and understanding in order to reach to the proper clinical decision, diagnosis and treatment of the patient or the healthcare consumer. This is very important, and we have all to remember this. Let us postpone the details of these issues in my next presentation, live broadcasting also. Thank you so much, and I will meet you again in another presentation regarding challenges in modern clinical practice met with by healthcare professionals, doctors, physicians, and surgeons. Thank you so much. Professor Dr. Tariq Ali.